So first of all, there's a couple of different types of diabetes. So there's gestational diabetes, which is diabetes that you get while you're pregnant for a female. There's prediabetes, which is a value that says you don't have diabetes yet, but you're on the border for it, all right? So you need to be aware and watch what you're doing. Then there's type 1 diabetes and type 2 diabetes, and these are the two that we're going to focus on today because these are the ones that are clinically, you are now diagnosed with diabetes, well, gestational as well, but we're going to talk about type 1 and type 2 today, okay? So type 1 is usually diagnosed from infancy to like late 30s. It used to be called juvenile diabetes, but we have people who are not juveniles anymore that are going into type 1. Sometimes type 2 can become type 1. So it is called type 1 right now. This happens when the pancreas, which is an organ in your body, is producing little to no insulin at all. And insulin is a hormone in your body that actually takes the glucose and it drives the glucose inside the cell. When you have glucose inside your cell, you're producing energy, your metabolism is up, and you're feeling really great, okay? So insulin's very important. Also, what happens in type 1 is your body's own immune system attacks the insulin producing cells that are in the pancreas and actually destroys it. So you no longer have the cells in order to even produce the insulin, okay? These people who are diagnosed with type 1 diabetes usually have to give themselves a shot of insulin. Sometimes they'll have a pump that automatically gives them a shot. Sometimes they'll be on some prescription drugs, and they also need to do some type of lifestyle intervention, diet, exercise, movement, those type of things, okay? So that's type 1. Type 2 diabetes is usually diagnosed after age 40, but honestly, because of the obesity epidemic, we're seeing a lot of children that are diagnosed with type 2 diabetes. So this is why this is a really important topic. In type 2 diabetes, the pancreas produces insulin, but it's not producing enough insulin, or the insulin is not actually being used properly, or the receptors aren't working correctly, which means that they're not actually getting inside the cell the way that they're supposed to. People who are diagnosed with type 2 diabetes usually are on prescription medications, sometimes like metformin is one that's commonly used, glipizide. It can also be controlled with lifestyle changes like diet and exercise. So what I want you guys to understand is that diabetes is preventable, people. It is preventable. I really need for you guys to understand that if you change your diet, if you exercise, if you just do a couple of things, this is preventable. All right, and once you're diagnosed with diabetes, and if it's not controlled properly, it presents with a myriad of different onslaught of other problems like cardiovascular issues, ulcers, wounds in your skin, foot issues like amputations that have to happen, hand issues, visual problems. So most people who are diagnosed with diabetes usually need to be seen by an ophthalmologist, a podiatrist, a nephrologist, which helps with kidney issues. So these are the people sometimes that you will see that are on dialysis, all right? So I want to give you guys some of the causes. So I've heard a lot of people tell me that, oh, you know, I'm a risk factor for diabetes because all my family has it, and that it's genetic. So diabetes is not proven to be a genetic thing or hereditary. So because it runs in families, I'm thinking that it's more environmental. Families who live together tend to eat the same foods. They have the same lifestyle activities, like either being sedentary, they live in the same area, so it might be some environmental toxins that are going on. So environment and lifestyle factors and diet play a huge part in your risk factor for diabetes, okay? So that's the causes. Symptoms. Let's talk about the symptoms, because if you have any of these symptoms, I'm going to encourage you to please go see your doctor. These can be life-threatening if they're not managed or if they're not properly assessed right away. They could be something other than diabetes, but these are the common symptoms that you might have diabetes. Okay, so extreme thirst, frequent urination, fatigue or drowsiness or lethargy, sugar in the urine. So that's when the doctor does a dipstick and you give them the urine, and the doctor looks at it and you're spilling urine, and you're spilling sugar in your urine. Sudden visual changes. So not like over 3 or 4 years you have to get your eyesight, your glasses adjusted. This is like sudden eyesight changes, usually like blurred vision or double vision. An increase in your appetite and weight gain. Also, sudden weight loss is a cause. Sudden weight loss also is a red flag for cancer as well. Your breath has an odor to it. So the breath of somebody who has diabetes is sweet. It smells like sugar or wine. It's fruity, okay? Because that's what glucose smells like. Heavy labored breathing. So that's what it sounds like. A stupor or an unconsciousness. So the person kind of like is just staring, or they're unconscious, okay? So we usually think of that as type 1 usually, but when there's glucose involved and sugar goes low or too high, you can become unconscious, and that's why this is so important to recognize these signs, all right? Not only for yourself, but also for a loved one, okay? So let's go over some of the lab values that your doctor can do and what's normal and what's not normal. So my vital ones know specifically that I don't necessarily go off of standard reference ranges. There's something called an optimal range, and as we become a more sick population, the standard reference range changes. So I like to work in an optimal range, but for today's program, I'm going to give you guys the standard reference range as well as the optimal range. So glucose is the sugar that we're measuring, and we normally measure sugar fasting, and we also measure sugar after you've eaten, which is called postprandial. So the normal guidelines for glucose for a person who doesn't have diabetes would be 69 to 99. And after a meal, it should be no more than 140 if you're pricking your finger and actually testing your sugar levels, okay? So optimal would be 75 to 86. So you can see that there's quite a difference in the range, all right? If you have diabetes, usually any kind of fasting blood sugar glucose of over 126, we're going to diagnose you with diabetes at that point, okay? So there is something called hemoglobin A1C. This is where there's sugar on your blood cell that's glycosylated or it's kind of crystallized, and this is the one where diabetic patients cannot cheat on their labs. A lot of people they'll hang out, they'll not have sugar, they'll be really good with their diet right before they go in for blood work with their doctors, but this is the one that you can't cheat on because hemoglobin A1C is measuring your blood glucose over 3 months. So you can't really cheat on this one. The normal level is anywhere from 5.7 to 6.4, and we'll say, okay, no, you don't have diabetes. Optimal ranges for a hemoglobin A1C, though, would be 4.5 to 5.5. So I want all my patients to be in the 4.5 to 5.5 range. So anything that I've said that is normal or diabetic, if you're in between that range, that means we call it pre-diabetes. Like you're on the borderline and we really need to watch this, okay? So those are the testing for it. So I know what you guys are here for. You guys are here to hear my naturopathic treatments for diabetes. So of course, I'm going to talk about some herbs. There are many herbs for that you can use that are already in your cabinet that can help with diabetic treatment, with management, that are safe to use with your prescription drugs. I picked out 3 because these are the 3 that I think most people have in their cabinet. I know all my vital ones have it in their cabinet. So number 1 is cinnamon. Cinnamon actually clinically, okay, and so all 3 that I chose also have clinical studies behind them. So clinically, cinnamon is shown to lower blood sugar levels, lower your LDL cholesterol, that's the bad one, increase the HDL levels, which is the good one. You can add cinnamon to oatmeal, your coffee, your tea, you sprinkle it on your toast. There's a myriad of different ways that you can actually use cinnamon. Get it in every day, and this is a really easy way to help with your blood sugar levels and your diabetes. All right, number 2 is ginger. Ginger is fantastic. So 3 grams in a capsule form daily is proven to lower your cholesterol levels, maintain your blood sugar levels, and keep you at a healthy weight level. All right. If you don't want to do a capsule of ginger, of course you can use fresh ginger. 3 to 4 cups of a ginger tea every day. Also, using fresh ginger in a stir fry with vegetables is a really good way to get your ginger in there. You can put ginger in your green tea. You can put ginger in your coffee. There's a lot of different ways you can use ginger. Number 3 is turmeric, and I've been talking a lot about turmeric, and there's a lot of hype in the media about turmeric right now, and it's really good for diabetes as well. So clinically, it's been proven to help lower blood sugar levels. It's anti-inflammatory. It helps to decrease weight, and it helps with kidney issues. All right, so turmeric is one of my favorites as well. So that's the herbs that I'm going to talk about. Let's talk about some essential oils. All the oils that I'm telling you about right now have the same properties as the herbs. So basically, they're going to help with blood sugar levels. They're anti-inflammatory. So the herbs that I chose to tell you guys about are cinnamon, black pepper, lemongrass, and rosemary. And here's how you're going to use these oils. You're going to put them in a carrier oil and rub them, do a foot massage. Okay, foot massage 3 to 4 times a week. You can put drops in your water and drink it like that. You can put it in your tea, or you can use it in a capsule form. I specifically want to touch on rosemary essential oil. When you mix rosemary essential oil in a carrier oil, it has clinical proven studies that when you rub this on a diabetic wound, it helps to repair the wound faster. Okay, so that's rosemary essential oil. Now we're going to talk about the blood type diet and how it affects diabetes. So I'm going to talk about the different blood types. I'm going to give you foods to avoid and foods to add into your diet if you have diabetes. When I'm talking about the foods to avoid, you're avoiding them specifically because they increase insulin resistance. They make it so that the insulin cannot get inside the cell and it cannot drive that glucose inside the cell. Okay, it's also, these are foods that are poorly digested, and these are foods that block digestive enzymes, and they impair caloric utilization, so you can't use your calories properly. All right, so those are the avoids. That's what they're doing. This is why I don't want you to have those foods. If I'm telling you to add the food in your diet, I'm telling you to add the food in your diet because it aids in metabolism. It helps with digestion. It improves insulin metabolism. So those are the foods that I'm telling you to add into your diet. So let's start off with blood type O, of course, all right? So you're going to avoid wheat, corn, and dairy. You're going to add in a lean organic red meat, walnuts, broccoli, spinach, and kale. Let me say that again. Blood type O needs to avoid wheat,